Well, thank you everyone for joining. It's great to be here with you today and to share the results of the study that we've been conducting to look at the differences in diagnosis of celiac disease across the different countries. We'll just give some quick introductions. So I'm Hannah Knight. I'm a senior project manager at Adelphi Real World, and we are a company based in the UK, specialising in real world evidence generation. And we conduct large-scale global surveys of doctors and patients across the world, known as our disease-specific programs. And these programs gather insights into how doctors are managing diseases across the world, but also looking at patient perspectives of disease as well. So at Adelphi World, we set up our disease-specific program for celiac disease back in 2020, acknowledging really the large unmet need in the celiac disease space and the vast need for real-world data and more understanding about the disease area. And since then, we've been partnering with Marilyn and the Celiac Disease Foundation to explore the data that we've collected, and we'll share some of those findings with you today. But really, we want to feed back the findings that we have to the celiac community to share the results with you, to help you understand as well what we're doing and really gain more of an understanding of what is going on across the world in terms of celiac disease diagnosis. So with that, I've also got Marilyn on the line from the Celiac Disease Foundation, and also my colleague Neve. So if you two would like to introduce yourselves.
Certainly. I am Marilyn Geller. I am the CEO of the Celiac Disease Foundation. In honor of International May Celiac Awareness Day, we are very thrilled to be invited to present what I think you're going to find to be very interesting data with the partnership with the Adelphi Real World. So thank you.
Thanks, Marilyn. Hi, everyone. My name's Neve, and I'm a Senior Programme Executive at Adelphi Real World. My area of focus is in the autoimmune franchise, and I specialise in the gastroenterology and have more recently in the dermatology areas. I've been involved with Adelphi and the DSPs, as Hannah has just described, especially the one for celiac, for over 2 years, and have been involved in numerous publications, both with the CDF as well. We're very passionate about any research regarding celiac disease, and especially encouraging both patient-friendly as well as the scientific community on the real-world issues and the impacts that people living with celiac have. As this is, for me personally, a disease that's close to my heart, as I also have family members that do suffer from the disease. So I found it very interesting from a personal perspective as well. I'll hand back over to Hannah to continue with the presentation.
So as a bit of a background, I'm sure you're all aware what celiac disease is, but simply put, it's an autoimmune disease of the gut. And what's known is that late or delayed diagnosis of celiac disease can lead to long-term health problems and other autoimmune disorders potentially as well. But what we found is that actually there's very little known about how different countries across the world diagnose celiac disease. What are the differences in how patients receive their diagnosis and that overall journey to the celiac disease diagnosis? So our aim, therefore, was to understand those differences across 4 countries that we focused on: the US, Germany, Italy, and Spain, to see where the differences in the approaches to celiac disease diagnosis lay. So in order to collect data, we provided surveys to doctors and patients across those 4 countries that I've just described, and we collected data from both the doctors and the patients between July 2021 and January 2022. We asked doctors to complete questionnaires or surveys about the next patients that they saw in a clinic who had celiac disease. So this is specifically adult patients, and to be included in the study, patients had to have been showing symptoms of celiac disease within the last 12 months, so that we're really collecting a sample of patients who perhaps still needing to achieve that disease control are still suffering from symptoms as a result of their disease. From the doctors, they provided information about the patient's journey from the first time that the patient saw a doctor with presentation of celiac disease or symptoms of celiac disease, right through to the diagnosis, including reasons for a delayed diagnosis if that did indeed occur, and any tests that we use to diagnose the patients as well. From the patient perspective, we gathered information about their awareness of disease before they were diagnosed with celiac disease, and also just their perspective of the journey that led to their diagnosis as well. So in total, we collected data from 278 doctors, and this was a mix of gastroenterologists and primary care physicians from across all 4 of the countries. Those doctors provided information about 2,244 patients with celiac disease, and you'll see here the split across the different countries. So we had 792 patients from the US and over 400 patients from each of Germany, Italy, and Spain. Those same patients were then invited to complete a questionnaire to provide their perspective of their disease journey. Now, this was a voluntary questionnaire, so you'll see that we have 941 patients who agreed to complete that survey, ranging from 135 patients in Italy to 289 patients in the US. So this was a voluntary survey, but it really enables us to see both the physician perspective, the doctor perspective of the patient's disease, but from those same patients to understand how they felt their journey to diagnosis was. Just to give you a quick overview of our overall sample of patients, what we saw is that patients in overall were quite similar across the countries in terms of their overall demographic characteristics. So their average age, for example, we see is around about 34 up to 40 years of age across the countries. Over half of patients were female. In terms of BMI, patients typically fell within the normal BMI category. There were some slight differences in smoking status, where we saw that patients in Italy were a lot more likely to be current smokers. So 22% of our sample in Italy were current smokers, compared to just 7% in the US. And then finally, in terms of employment status, approximately half to 64% were in full-time employment. So in overall, quite similar baseline characteristics across the 4 different countries. So we'll move on now to look at the journey to diagnosis, and I'll pass over to Neve to talk through these results.
Thank you, Hannah. As Hannah has just mentioned, the way we have broken down the results into digestible chunks is essentially following the patient journey. So to begin with, we start off with from the start of symptoms to the first doctor's appointment. And on average, patients waited between 5.8 and 17.7 months before seeing a doctor after they first noticed their symptoms. And as you can see from the chart, patients in Germany waited the least amount of time, whilst patients in the US typically waited a longer period of time of the 17.7 months from initially experiencing symptoms to actually going to see their doctor regarding the symptoms. We also looked at the top reasons for this delay. This is from the patient's perspective. We asked them why they did wait. As you can see from here, our top 3 reasons are waiting to see if symptoms would go away on their own, or trying to manage their condition through either a diet or through non-prescriptive drugs, so over-the-counter medication. And as we can see from this chart, 85% of patients in Germany waited to see if their symptoms would go away on their own, whereas the changes in diet was most common within the US patients. Next, we move on to from the first time they saw their doctor to actually achieving the diagnosis of celiac disease. Patients waited between 1 and 3 months after they saw their doctor for the first time to their diagnosis of celiac disease. And again, as you can see from the chart, this time patients in the US actually waited the least amount of time. They experienced the shortest delay between that first appointment and actually achieving the diagnosis of celiac disease, whilst patients in Spain had a much longer delay in diagnosis of the 3 months. We also looked at the top reasons for the delays, as we did with the delay between first showing symptoms to go and see their doctor. We then looked at the reasons for the delay between the first doctor's appointment and the diagnosis. And the top 3 reasons for the delay are waiting for tests to be performed, waiting for specialist referral, and waiting for test results. Doctors in the US, Italy, and Spain all reported the most common delay was due to waiting for tests, waiting for the test that they used to diagnose to be performed. Whilst in Germany, doctors typically waited for the specialist referral. We also looked into misdiagnosis. 1 in 3 patients were misdiagnosed before being diagnosed with celiac disease, and as you can see from across the different countries, this is pretty consistent throughout. However, misdiagnosis was most common in Italy, with 41% of patients within our data set experiencing some form of misdiagnosis. Which then led us to what the most common conditions were that patients were misdiagnosed with. And of those that were misdiagnosed, patients were commonly misdiagnosed with either irritable bowel syndrome, IBS, lactose intolerance, or gastroesophageal reflux disease, which is also known as GERDS. Celiac disease was misdiagnosed with IBS more often in the US than in any other country. And I will pass back over to Hannah to go through the diagnosis.
Thanks, Neve. Yeah, so now reaching the final stage of the patient journey to diagnosis that we've explored. We asked the doctors to report what the main events leading to the diagnosis of celiac disease was for each of the patients. And perhaps unsurprisingly, the main reason that we see, so for over 80% of patients overall, it was the presentation of symptoms. So the presenting of symptoms was the main thing that led the patient to receiving their celiac disease diagnosis. Other reasons, though, include testing for other diseases. So this was reported to be one of the events leading to diagnosis of celiac disease for between 10 and 16% of our patients. So this will be if the doctor suspects another condition, for example, and then is performing tests to confirm that condition, then perhaps this has actually led to them realizing that it's actually celiac disease that the patient is suffering with, not some other condition. Another reason is due to screening programs. Now, we see here that there's quite a considerable difference across some of the countries here. So 18% of patients in our sample from Italy were diagnosed as a result of a celiac disease screening program, whereas this is much lower, in 2% in Spain, up to 5% in the US. So obviously screening programs perhaps less common in those countries compared to Italy, where almost a fifth of the patients were diagnosed through a screening program. Testing due to family history was another fairly common reason that the patient was diagnosed. More common we see here in Spain and the US. So patients with family members who have celiac disease being tested, but this is much lower in Germany and Italy, just 6 to 8% being tested due to family history there. And the final reason here is looking at patients requesting to be tested for celiac disease. So perhaps celiac disease is a condition they are already aware of, and they suspect that they might have it and are going to their doctor requesting to be tested. Now, this is between 10 and 13% in US, Italy, and Spain. A lot less common in Germany, just 5% of patients requesting to be tested for celiac disease in Germany. And as we move to the next slide, we see perhaps why that might be. We asked patients in our sample to tell us whether they had heard of celiac disease before they were diagnosed with it. And in Germany, actually only 14% of patients had actually heard of the condition before being diagnosed with celiac disease. This is compared to around 50%, half of our sample, in the other 3 countries. So that it's likely that that low awareness overall of celiac disease in Germany is meaning that patients, they're not going to be requesting to be tested for it because they're simply not aware of it. Our final slide of results then is looking at the tests used by doctors to diagnose the celiac disease in these patients. The main tests that physicians or doctors use to test for celiac disease include blood tests, imaging tests such as MRIs and X-rays, and biopsies. And we see that these are all used pretty frequently across each of those 4 countries. But in overall, generally the US, they are using fewer tests actually to confirm the diagnosis of celiac disease. So while they are using blood tests, imaging tests, and biopsies, it's less frequent than in the European countries. Okay, so those were the findings that we wanted to share with you. I'll just pass back to Neve to sum up and recap what we found.
Thanks, Hannah. Yeah, just to summarise really, we're aware that we have just provided you with a lot of information. So we've broke it down a bit to, again, just recap on what we've already mentioned. It will also be good for those that have just joined to get a quick recap of what we've been through. Patients waited on average between 6 and 18 months to go to the doctor after starting to show symptoms. And as we saw, patients in Germany responded the fastest. Most patients waited to see if their symptoms would go away on their own before they consulted a doctor. Despite the longest amount of time despite taking the longest amount of time to see a doctor after starting to show symptoms, patients in the US were actually diagnosed the quickest. The misdiagnosis rates were similar across countries, with 1 in 3 patients experiencing a misdiagnosis. Italy had the most screening programs, yet the highest rates of misdiagnosis were also seen in Italy. For most patients, showing symptoms was the main reason that they were diagnosed with celiac disease. And testing because of a family history of celiac disease was most common in Spain and the US compared to the other 2 countries. Physicians in the US use the least number of tests when diagnosing patients with celiac disease compared to the other markets. And before being diagnosed with celiac disease, patients in Italy and Spain had the greatest awareness of celiac disease. And as just mentioned, those in Germany were least aware. Moving on to our conclusion, we have 3 key points that we really want to just reiterate from everything that we have just said. Patients experience considerable differences in their journey to celiac disease diagnosis, depending on whether they are in the US, Germany, Italy, or Spain. Future research is needed to understand the impact of the different countries' approaches and the delayed diagnosis on patients. And the increased education and awareness of celiac disease is required to reduce the high rates of misdiagnosis in patients in certain markets. Thank you all for listening to us today. I have seen that there have been a few comments within the chat, but if there are any questions now, we're more than happy to answer any questions.
Also in the chat, we've put the links to the 2 papers that were put together and presented at the AOECS General Assembly last year on these studies. Do we have any hands raised? I can't see that currently.
I think I can see a hand raised from, is it Louisa?
Thank you. Can you hear me?
Yes.
Hi, I just wanted to see back the last slide about literature. Okay, and I just wanted to know whether the data have been published yet on some paper, on some journal.
Yes, so as Marilyn was just saying about in the chat, she's, I think, posted the links to the publications that we've worked on and that were presented at the Assembly earlier this year or last year. So they're
Right,
within, yeah, go ahead, Marilyn.
There are 2 different papers. So one was looking at the patient version of this and the other was at the physician. So you'll see that there's links to 2 different papers. So we have a question about if there's any plans to look at data in the UK. Does Adelphi have any plans to look at data in the UK?
That's a great question. Yes, we would definitely be interested in expanding our research into the UK. In full transparency, the way that we work at Adelphi Real World is that we work with pharma companies in order to support them in developing treatments. And so we typically field or collect data from the countries that are of most interest to the pharma companies, in that they will typically use data from certain countries, so the US, Italy, Germany, and Spain in this instance, and almost extrapolate that data and look at other markets based on that. Now, as we've seen, there are differences between the countries that we've reported on here, so there are likely to be differences again if we were to look at the UK, but it would definitely be very interesting and something that we would be keen to look into further.
We have a question from Maria about being diagnosed, and she says that she's had 2 biopsies and genetic testing, but since her antibody levels were negative, her insurance does not recognize it. I can't respond to that because in the United States, if you're on a gluten-free diet, but your biopsy still shows that you have the gut damage, you are diagnosed with celiac disease, whether or not you have antibodies to the TTG blood test. So Maria, if you could put in the chat box what country you're from, and perhaps somebody from AOECS can get more information for you. We'll see what we can help, what we can find out. And then Andra asks if there's any plan to have an awareness campaign for screening at the EU level. And this would be a Sue or Veronica question. If you're not able to answer, we can certainly try to get back to Andra at a later date. Okay, well, I do not see any other questions. Thank you for allowing us to share this data with you. And I, hopefully it gives us, it's eye-opening, right? The things that we've been taught. But it looks like screening, at least in the last 10 years, and the awareness of celiac disease has increased. We used to say that only about 20% were diagnosed and that very little people had heard about it. And we're seeing about half the patients had actually heard of celiac disease. And certainly far more encouraging to see those people get diagnosed than the 4 to 11 years it used to be. So again, thank you, everyone. Thank you to the Adelphi team for what I do think is this very valuable data. And thank you to AOECS. Happy May Celiac Awareness Day.
I'm sorry, it's Maria here. Can I make one more question? I'm sorry.
Question, was that?
Yes, it's Maria here. I don't know. Can I make a question?
Yeah, of course, go ahead.
Yes. Is there any global guideline for children with parents that has been diagnosed later in life? I get a very great response every time I ask the doctor. So I have 3 kids. And the thing is that it took me 2 years to get diagnosed. I don't have symptoms. I don't have, not the symptoms typical from celiac disease. I don't have antibodies. And it's a bit like, okay, if I can prevent my kids from getting to a severe anemia and all the other side effects that I have gotten in the past 2 years, that would be great. But nobody wants to test them.
I don't know, Marilyn, if that's something that you can talk to.
In the US, they would be tested. So I really can't speak to Belgium, but hopefully with the AOECS team, we can find out more information for you.
Thank you.